Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Red cell fragments showing cystocytosis. Red cell fragments or cystocytosis, these include microangiopathic hemolytic anemia. Here there are cystocytes will be seen. Why are these cystocytes mainly seen? Whenever the RBCs will pass through the narrow or thrombosed vessels, then in order to squeeze through the small RBCs, cell membrane becomes fragile and it breaks out down, resulting in these cystocytes. So these are seen in microangiopathic hemolytic anemia, disseminated intravascular coagulation, hemolytic uremic syndrome, or they are seen in thrombotic thrombocytopenic purpura.
thank you and thank you for watching.